they're buffers, they're processes that help insulate us and help give us that added safety net when there's so much coming at us and there's so much stress percolating. We can leverage and harness those protective factors in our life, those activities, the mindsets of resilience. And then another big thing, obviously, in light of the mandates for social distancing, a lot of us have said, no, let's reframe that as physical distancing and recognizing the power of using the tools of today to continue to connect that we're in community with, to continue to foster relationships. What we know is that relationships are amongst the most protective factors that we have as a species. And it's really hard being apart and being physically distanced, but again, being creative and innovative about how are you connecting with those around you, and maybe even forming new people in your circle. If you find yourself isolated, that's very common in today's world. It's important that we recognize, even through our workplaces, many of us have EAP that we can access in order to get therapy. And there's a lot of telehealth happening now where we can check in and we can have a confidential confidant to help us strategically think about our well-being. And again, there's a host of ways that we can really work to build those trusting relationships where we can name our emotional processes, that we can receive the support, that we can think strategically about how to continue to protect our mental health, to prevent decline in our mental health, again, at a time where that almost feels inevitable. We really need to harness our resources, and that comes in community. That's where we see people heal and be able to persevere even through trauma and crisis. I know in industry, I've worked in a wide range of settings with a wide range of populations. I worked a lot after 9/11 and the disaster response effort. And in that also, I've worked with a lot of people who've gone through tremendous trauma, tremendous loss and destruction in circumstances that are just unfathomable. I think it's really important that we recognize that even though this is a test of a lifetime, it's something our eyes have never seen before. Again, we are very, very much capable of harnessing what we know can protect us. So I just want to encourage all of you, as you're going through the exercises this week and the reading and viewing this, to think about what protective factors are in reach for me right now. It's easy to see the things that we've lost control over, but what are the things you can focus in on and you can harness and leverage to, again, protect you and to help you foster that sense of resilience as a person. Start to think about one or two things that you have in your reach and how you continue to leverage them.